Welcome to Ask a Construction Health and Safety Expert with Deb Moskal and Dave Dametto. I'm your host, Ken Rayner. This 5-part series is designed to give new Ontario construction businesses the essential health and safety information needed to keep workers healthy and safe and businesses compliant. Each year, IHSA welcomes around 10,000 new construction firms through automatic membership with WSIB. That membership gives you and your new construction business access to low or no-cost training, tools, and expert guidance. And this series is part of that support. Many of the questions that we will cover have come directly from Ontario construction businesses with less than 5 employees, companies just like yours. Today's episode covers the steps to take as your Ontario construction business grows. When you're no longer on site with every employee, it's crucial to formalize processes like creating a health and safety policy and program so your team knows how to work healthy and safe. And I'm very grateful once again to be joined by our experts, Deb Moskal and Dave Dametto. Okay, Dave, let's start off with the basics. Can you help us better understand what is an occupational health and safety policy and why is it so important?
Well, Ken, the occupational health and safety policy is a written commitment from the employer to ensure that the workplace is safe for workers and others within that workplace. It explains the commitment that the company has for that health and safety of their workers. Why is it important? Well, under the Occupational Health and Safety Act, a company who has more than 5 workers is legally obligated to have this policy in place. It needs to be written, posted, and reviewed annually. It's going to promote health and safety by encouraging the workplace culture for that positive safety culture that we want to happen. It's going to help prevent incidents and accidents within our sites because it's going to demonstrate that commitment. It's legal protection. So because it's a legal obligation, we want to make sure that that commitment is happening and that they're able to show that they're doing what they're supposed to be doing. It's going to boost morale for workers who are coming into an organization knowing that their company has a commitment to their health and safety. They're going to want to work for that company. It's going to be able to improve productivity where there's less incidents or accidents or downtime within that company. Again, that productivity is going to go up. And it's going to ensure a legal obligation because you're following the rules that are set out in our Occupational Health and Safety Act and related legislation.
Excellent. So it's a written commitment from the employer to its workers on how that employer is going to keep them safe and send them home every day healthy.
For sure.
All right. Now let's get into the program, Deb.
Sure.
Right? So what is then an occupational health and safety program and how does it support the policy?
Right. So the program is your processes, your practices, your procedures that are in place to protect the health and safety and well-being of the staff. So as you said, it forms the basis of how the commitment that Dave was speaking to in the policy statement is going to be achieved. So it really puts the program into action. So it takes that commitment and it defines how are we going to meet the criteria set out in the policy. So that could be through training, through conducting inspections. It's going to help engage workers. It'll set criteria such as training and even meeting requirements to really create that engagement and that open door for communication between the different workplace parties. It will help us ensure compliance. We know that employers need to be compliant with the Act and all of the regulations that apply to the work that they're doing. So the program will be built around their specific tasks and the specific legislation that applies to help them make sure they're meeting due diligence and compliance requirements. It will help them overall reduce risks. So it should contain the hazard assessment process as an example, an inspection requirement to help them proactively identify hazards and make sure that those hazards are mitigated, like we talked about in episode 2, to appropriate levels. It'll also help them track progress. So within the content of the program, They will be required to define key performance indicators or KPIs. So requirements for supervisors to do weekly inspections, require for health and safety representatives to do a monthly inspection, and any other criteria that may be defined. It gives them a measuring tool to say, yes, we are meeting this KPI or we're not. And you can look at that then both qualitatively and quantitatively for the employer. So are we meeting the target in the number criteria? And to what degree are those documents being completed accurately, fully completed, et cetera. So to help them, monitor their progress. And like we said before, it's going to help them show the compliance side of it as well. I mean, the goal of the program is to, help support the policy, but the ultimate goal here is really to get workers home safely and healthily.
Dave, I know you mentioned this in your last answer, but let's just be clear about this. When exactly is an occupational health and safety policy and program required in Ontario via legislation?
Yeah, so Ken, the policy itself, like I said before, once you've got more than 5 workers, so that's 6 and above, needs to come into play. Like I said before, it needs to be written, it needs to be posted, it needs to be reviewed annually by the organization. The program itself, like Deborah said, where it's going to implement that policy, that commitment, again, when you've got more than 5 workers, but that also goes into a little bit more detail if there's hazardous substances on your project, or if you're ordered by a Ministry of Labour inspector to have a program. So that comes into play as well. Like Deborah said, the policy itself is going to start off with, and we'll talk more into it a little bit later on, under hazard assessments. It's a huge part of it. We talked about it in episode 2, big part of it. Safe work practices, safe job procedures, training, inspections, and incident reporting all need to be part of it. What I like to stress, though, is even though the legislation speaks to more than 5 workers, it's going to be great for a company to start, even if there are less than 5 workers, to get this policy and this program into play. As they grow, it's going to be easier for them to be able to implement as they go through.
Yeah, absolutely. And again, when we're talking about legislation, what's noted in the Green Book or the Occupational Health and Safety Act, that's the minimum requirement.
Right.
That's where we're saying you must, but you can still take action and go above and beyond the Occupational Health and Safety Act, like starting your policy before you end up having 6 workers, right? Okay. Now, Deb, let's talk about maybe what are the components, what needs to be included in an occupational health and safety policy.
Sure. So Ontario legislation doesn't provide a template for this. So what I would say would be some important aspects would first and foremost be the commitment from the employer, commitment to prioritize health and safety in the workplace, as well as commitment to, continue to implement ongoing safety improvements. I think a commitment from the employer to ensure that they follow applicable acts and regulations would be important. The policy statement should outline roles, responsibilities of the main workplace parties. So generally here, the employer, supervisor, and workers, but also speak to worker rights in the province of Ontario. Just to go back a bit to what Dave said, I think also talking about the importance of identifying and controlling hazards to ensure we have a safe workplace would be important. You'll want to make sure the policy is reviewed at least annually and posted in a visible location in the workplace. Ask your staff about the policy statement. We've updated it this year. Do you have any questions? Gauge their understanding, gauge their level of engagement with that policy statement. And at the end of the day, I think it really does help us to ensure compliance and accountability within the organization.
Okay. And Dave, let me ask you the same question, except in regards to the program. So what are those key components that really, a new construction business, as they're growing and they're building, they really want to ensure that these components are part of the program. What are some of those? Yeah,
Ken, like Deborah had said with the policy is what we're going to have to do. The program tells us how we're going to do it. So I call the policy the feel-good statement, right? It's telling everybody we're going to do everything right. Now the program is going to tell us what we have to do. this is not the be-all and end-all list. As your company grows, you may have to expand your program to meet your requirements.
Right.
But like we said in episode 2 yesterday, the hazard assessment is a key one. Like that is looking at what your hazards are, putting the control measures in place is key to our program. And when you're looking at controls, using that hierarchies of control all the way from the beginning part of elimination, substitution, engineering controls, all the way down to our personal protective equipment, which should be the last thing that's being used. Roles and responsibilities. So our policy will have roles and responsibilities, but each part of your program will have roles and responsibilities set out. And depending on your organization, from the employer all the way down to the worker, we want to have roles and responsibilities set out. Training and education. The policy is going to commit to training and educating our workers. The program is going to go into great detail. What do we have to train our workers on? What are we going to have to educate them on when it comes to what we want them to do on our sites? Incident reporting. So if something were to go wrong, we want to make sure that we have a procedure in place that's going to show us how we're going to investigate that to make sure it doesn't happen again. Workplace inspections. So the regulations will speak to requirements to do workplace inspections for certain workplace parties. We want to ensure that we're meeting at least those minimum requirements, and in some cases we may have to go above and beyond that. Emergency preparedness is another one. We want to make sure that in case of an emergency, we have set procedures within our program that's going to allow us to deal with those issues that are arising on our sites. Equipment maintenance, ensuring tools, machinery, and equipment are properly maintained so that the workers are able to use them safely and it's not going to injure them. Worker participation. When do we do all this? When do we inform them? So are there safety meetings that have to happen? We talked in our previous episodes about orientations. When are these things going to happen? Do we have company-wide meetings where everybody's going to be attending? And there's different criteria set out for all of those. Record keeping. I remember when I was a consultant that I'd be teaching programs saying, if it's not in writing, it didn't happen. So whether it be training or whether it be our safety meetings or whether it be inspections or investigations of incidents that have happened on our sites, if we haven't documented that, it didn't happen. So we have to have a place in our program that deals with that. As well as monitoring and improvement. The whole idea of health and safety is we want to keep getting better and better, because at the end of the day, it's all about keeping those workers safe. And this is like, basic stuff that, should be in every program. And again, but not the be all and end all list.
Right. All right. Thanks. Deb, I've had the opportunity to write some policies for IHSA. It's not my favorite thing to do, I'll tell you quite, but I know it's needed, and you have to, for all the things that the two of you just outlined. But my belief is that to use the term, the rubber hits the road, that happens when you implement. Right. So, there's lots of organizations out there with a written policy that they may not have gone the full length to say, now we need to really implement. Once you've written the policy, that's not where it ends, that's where it starts. And now the implementation piece. So maybe we can talk about that. How do you go about implementing and supporting that occupational health and safety policy? Because that's, again, where you're still going to start to get some real traction.
I agree. So the policy statement is the paper document, right? It's the commitment. It's signed by the head person of the organization, but it's paper. So now we look to the workforce and to that program that we spoke to really ensure that we are meeting those targets. And it's not just a piece of paper on a wall, right? So the first thing you want to do is communicate it. Staff need to know that it exists and what it contains. So communicate it, post it, ask them questions. Like I said before, gauge their understanding. You need to have the program in place to really support the policy. Because as Dave said, the program is how are we going to achieve the criteria in that policy statement. So develop your practices, develop your procedures to really make sure you're meeting those objectives in there. Responsibilities need to be clearly assigned and communicated to the workplace parties, and the expectation in the program may even need to be enforced, and nobody is exempt from that, including the employer, right? You can't, or we can't expect workers to follow the rules, but the supervisor or the employer's not. So it really needs to be a collective front to make sure that we're all striving towards that same goal, and having that open communication for the reporting of hazards, right? We want workers to report hazards. It's not a punitive process. And the reason we really want to focus on the hazards is that's our leading indicators. We haven't had an incident occur yet. We haven't had someone almost get hurt in the near miss phase. We've got a chance to really correct this before we escalate down that road of severity. So you want your program to encourage that open dialogue, and you don't want the fear of reprisal, because this is a benefit to the organization as a whole. Keep your records, as Dave said, right? If it's not documented, unfortunately, it didn't happen. So any training records, any inspection records, records of disciplinary action, you really want to make sure that you keep those and make sure they're legible, because sometimes you see things that just aren't.
Yep.
So you want to make sure you have that. You want to make sure that you've given the staff the training to achieve the goals. So in an earlier episode, we talked to the 4-step, 5-step Ministry of Labor training, the WHMIS training. You talked about confined space. I talked about working at heights. All of that's important to meet the objectives, but also on the record keeping side as well. Make sure you review your program annually at a minimum. You may need to do it sooner if your scope of work changes. Maybe we're going into a new line of business. Maybe there's new regulations that have come into play. Annually, I would say, would be the absolute minimum to make sure that we are meeting our objectives. And if we're not, why aren't we? Right? There's a gap somewhere. Then we just need to figure out where that gap is and make sure we close the gap. Keep your workers engaged. Keep them involved if you can in development of safe work practices and procedures. Like we talked about in the hazard assessment process, if I'm writing a procedure or a practice, who better to engage than those that are actually doing the task and currently doing the task with the equipment and process and expectation that we currently have set in the program. So I think if we can integrate safety into the daily operations, we're going to protect the workers' health and safety and protect the perception of the organization and the longevity of the organization.
Perfect. And thank you very much. It's great to have, be able to leverage your 50 plus years of combined experience to get really a good understanding of what you need to do from a policy perspective, what do you need to do from a program perspective, not just to be compliant with legislation, but to really achieve what we are all striving for, which is that every worker goes home safe and healthy at the end of the day to the ones they love. So right. Terrific. Okay, we've got a couple of questions that we've gotten directly from some new Ontario construction businesses. Dave, I'm going to pose the first one to you. What resources does IHSA provide for free that I can start using to develop my policy and program?
Well, Ken, one of the first things that I would like to point the industry to is our construction health and safety app. Like, it's a great tool, resource. It's got information on legislation. It's got information on different topics, different hazards, as well as legislative requirements that need to be followed there. IHSA has subject matter experts throughout the province of Ontario. So you can go from Kenora all the way to Ottawa and everywhere in between. There is a consultant there to be able to leverage, as well as subject matter experts within IHSA, like ergonomists and so forth, that we're able to utilize. We have something called our M029, which is our Construction Health and Safety Manual. It is a fantastic resource, all the way from putting policies and programs together, all the way from different activities, occupational health, occupational illness. There's some great information there. Again, I think that one there is free of charge too, Ken?
Yes, it is.
This is for our firms, right?
Yep.
So it's awesome. Our policy and program templates that are available on our website. But I want to stress with those, they are generic. So you need to ensure that you're not just filling in company name and then have someone sign at the bottom. It needs to be tailored towards your organization and what you're going to be doing. And again, we can also have one of our subject matter experts be able to do that for you and assist you. Not do that, sorry, I'll clear that up. We'll assist you with doing that. Mm-hmm. When we have our training, we have a course that we spoke about in other episodes called the Basics of Supervising. And the Basics of Supervising, it's going to get you the information to be able to navigate the Occupational Health and Safety Act, your construction regulations, but it's going to go also into the requirements for the duties of the employer, duties of a supervisor, and different tasks that the supervisor are going to have to perform when they're out on site. And getting that information to our frontline supervisors is going to go a long way in keeping our workers safe.
Excellent. So just to run down those again, and those are all free that you've mentioned from IHSA. We've got our construction health and safety app, which you can download from our website, IHSA.ca. We've already had tens of thousands of Ontario workers download it, and they're utilizing it. So please make use of that. We've got our construction health and safety manual, over 400 pages. Kind of consider it the Bible when it comes to construction health and safety. And that, again, you can either look at the chapters online for free, or you can, if you're a member of IHSA, you can request that book in physical form at no cost. The policy and program, as you said, the templates. It's almost like we were AI before AI came about, right? Yeah. So you don't want to just put something into AI and use it just as it is. It's sort of meant to help you along, to give you those prompts, to give you an understanding of what's required. And again, as you mentioned, the basics of supervising class, which, in person, free of charge in the classroom, 2 days of just wonderful resources to help you out. So great. Thank you very much for covering all that, Dave. All right, Deb, I'm going to give you the last question we have from a new construction firm. Deb, I currently have 3 workers. What is the benefit of starting to build my program now?
I'd say the first thing to consider is, even though you have a smaller amount of workers, doesn't mean there aren't hazards present. So the main benefit right away that comes to my mind is proactive hazard and risk management. So there's still hazards that need to be addressed and considered. And so having the foundation program in place will help you to do that, even with a smaller scope of work. I think it shows and demonstrates the employer's commitment to employee well-being and morale. You still have processes in place. They may not be as robust as some of the bigger constructors out there, but maybe they don't need to be.
Yeah.
There's still a process in place for me to make sure that you're working safely and that you're being monitored in the work that you're doing. I think also there's a potential cost savings if you look on the financial aspect of this. If we have processes in place to identify hazard and mitigate risk, then hopefully we're not having workers get injured. And we know when there's an injury that occurs, there's WSIB costs, there's worker replacement costs, there's investigation time, which can be quite significant depending on the severity of that injury. So anything you can do proactively is going to help on that regard as well. I think company reputation can also come into play. Even though you're a smaller organization, if you're able to demonstrate that you are looking out for employee safety right from the get-go, I think that says a lot about an organization and owners of organizations and supervisors and workers, that they're going to do the job and they're going to do a great job, but they're going to do it safely and make sure that gets done safely. Also, I think as your organization continues to grow, you've already got the foundational pieces. So like we've talked about in previous episodes, I'm not feeling like I'm behind the 8 ball, perhaps. I've got some foundational concepts in place. Maybe we're using smaller scale that then I can go back in and look at expanding. But I'm not going to be in a situation where I'm scrambling, where now this becomes a requirement and I'm trying to put something together quickly. So I think there's a lot of benefit to it. I understand it may not be a requirement, but I would consider doing it from day one.
Absolutely. It's kind of like starting, when you're in school and starting studying for that exam ahead of time.
Right.
Like, you don't have to. You could leave it till the night before if you want to, but I know when I've done that, I've just caused myself a whole bunch of stress and anxiety, and I haven't slept well the night before. And so start it early, get moving on it, and then when you hire that 6th employee, you're pretty much already in compliance.
Absolutely.
Fantastic.
You're just tweaking at that point. Right?
Yep. Okay, thank you to our experts for all your guidance on this. Really appreciate it. And thank you for watching this episode of Ask a Construction Health and Safety Expert with Deb Moskal and Dave Dametto. IHSA is proud to support Ontario's construction industry, and we're proud to provide you with the tools and training you need to keep your workers healthy and safe and keep your business compliant. For more resources and more trusted information, visit us at IHSA.ca.